to folks about health care. And grants passed yesterday, I heard from All Care, and they felt like they were getting hit by a wrecking ball. In Deschutes County, we heard from volunteers in medicine. That is really frightening what they're up against, because they're helping people who are completely uninsured. And then we've got Planned Parenthood in the House, and I was just with them. And, you know, a lot of people don't even understand they're a lifeline in terms of fighting cancer. So all over the state, I can tell you, Oregonians have reached one judgment. The defunding of Medicaid that Donald Trump has engaged in is both destructive and despicable for 1 out of 3 Oregonians who are enrolled in Medicaid. And we're going to talk, for example, about some of the special ramifications I heard from. For example, rural hospitals. I mean, they have been an anchor for their communities, both in terms of life, jobs, community well-being. And they're telling Senator Merkley and I and Congresswoman Hoyle that they believe that their future is going to be really about whether they can keep the place open. That's what they have been telling me all over the state. So that's point number one. Point number two is I want people to understand this is just the beginning. Since my days when I was director of the Oregon Gray Panthers, this has been my specialty. And I can tell you this is not just Medicaid, people who are on the Medicaid program. Come October, we're going to see premiums go up. People are going to get notices all across the state. People are walking an economic tightrope. The hospitals will feel the ripple. The providers, all of you will feel the ripple. I'm concerned we don't have enough practitioners. Senator Merkley and I live in southeast Portland. At the bus queue around the corner from me over the last couple of weeks, people from British Columbia have been advertising saying, folks in Oregon, if you're a healthcare provider, you're not going to have a job. You better come with us. So that's what we're up against. And the three of us are a significant portion of the Oregon congressional delegation. And we're not going to sit around when Oregon healthcare is being hit by a Trump sledgehammer. And there is no other way to characterize it. So in the lingo of the United States Senate, let me yield to, he's yielding too. Under the protocol, I'm supposed to yield to him, but we're going to yield to the Congresswoman, and then the last word as we get going will be Senator Merkley. Congresswoman, thanks for your great work. We're in your district and anxious to listen. Please go ahead.
Thank you, and I want to thank Senator Wyden and Merkley for bringing us together. This is really critical. I worked with the United Way Healthcare Access Coalition prior to the Affordable Care Act. And at that time, many of you were in this fight, we had a 21% uninsured rate. And many of those people were small business people, right, who couldn't afford insurance premiums, or our farmers, right, and those who are most vulnerable and in need. And what we're seeing with this bill, which quite frankly, I'm appalled that my colleagues in Congress, my Republican colleagues, are blatantly lying about, are saying this isn't going to impact anything. Taking away the hospital provider tax, 11 of our 33 rural hospitals are on the verge of closure. These are in rural and frontier areas where there aren't other options to get care. And then the work that many of you do with the most vulnerable. It is the most vulnerable, and it is also people who, because of the Affordable Care Act, because of our expansion to Medicaid, we're able to insure all of our children. We are able to provide affordable health care access and insurance premiums to small business people, to individuals. We have, again, we pass laws to make sure that if you have a prior condition, you can still get health care. So the effects on Planned Parenthood, where so many people go to get their reproductive health care and their basic health care, it's their medical home. All of these things will be gutted. And at the federal government, my Republican colleagues are saying, we didn't do anything. This is on the states. Look, it is our federal responsibility to be partners in making sure people can access care, because that means we have healthier communities. It costs us all more when we have the type of uninsured rate that we had prior to the Affordable Care Act, because people don't go to the doctor and they end up in the hospital and they end up in debt and they end up losing their homes, right? Prior to the Affordable Care Act, remember, over 50% of bankruptcies were because of health care costs. And I don't know why anyone would want to take that away and then not take responsibility for it. So we're here to listen, and I just want to thank everyone for being here today. And with that, I yield to the good Senator Merkley.
President Trump put forward a vision that he called a big, beautiful bill that was going to help people out, not hurt people. But we call this bill the big, ugly betrayal, because in fact, it's a billionaires win and families lose proposition. Slashing health care across the country, some 15 million people to lose health care, to fund tax breaks for billionaires. Cutting nutrition programs for children. Millions of children will go hungry to fund tax breaks for billionaires. But this issue of health care is the biggest impact in this big, ugly betrayal of a bill. Here in Oregon, just the monetary impact, both in increased costs and decreased revenue, is about a $12 billion cut over 6 years. $2 billion a year impact, just to put it in monetary terms. But let's start with those tax credits that we're discussing. The Oregon Health Plan, Medicaid, is one way of providing health care to less affluent families. But a second provision was to be able to enable families to have tax credits to buy insurance on the healthcare exchange. And here in Lane County, that's about 12,600 people buying insurance on the exchange. The estimated cost for those buying insurance on the exchange is that they'll say about a 70% increase in costs, or roughly $1,300 per family per year. That's a huge, huge impact. And of course, some families will say we can't afford to pay those additional higher premiums. And then we have the impact that occurs because of the red tape being applied to the less affluent under the Oregon Health Plan. And some of that red tape is that you have to reapply not every 2 years, but every 6 months. And so you have to monitor those reappliances, and that monitoring is going to cost about $1.2 billion over 6 years. Monitoring the work requirements will cost about $4.8 billion, so a $6 billion cost in increased just monitoring of the program. Wouldn't it be better to put that $6 billion into health care directly? And let me be very clear about these so-called health requirements. What this bill does in providing enormous tax giveaway for billionaires, it rolls out the red carpet for the richest Americans. And it rolls out the red tape for the least affluent. Maybe we should fight for the opposite vision, a vision in which we make acquiring health care easy and affordable for ordinary Americans and have the billionaires paying their fair share. That would be a better vision than families lose and billionaires win. The impact of both the cost side and the impact on the red tape side is that we are looking at some 200,000 Oregonians losing health care under the Oregon Health Plan. 200,000. And it could be worse than that, because what if another provision which reduces the premium, the rates for provider taxes, which goes over 4 years from 6% cap to 3.5%, means the state will have less revenue to provide the Oregon match. Where's that money going to come from? What if Oregon can't provide the match? So it could be even worse than what I'm describing. And when 200,000 people don't have health insurance and they go to health clinics, well, the health clinics provide health care, but they don't get paid. Rural hospitals provide health care, but they don't get paid. What happens? They shut down programs, or they shut down altogether, and that's certainly the fear that both of my colleagues have spoken to. We're going to turn to local providers' perspectives, but this strategy of savaging healthcare, savaging the Affordable Care Act ability to provide health care, savaging Medicaid. It's just the wrong direction for America. It will do so much harm to so many. And we are dedicated to fighting and reversing this, opposing it in every possible way that we can. But let's turn to our local officials, starting with our commissioner, Heather Buck, who we're so delighted to have you here today.
Thank you. Thank you very much, Senator Wyden and Merkley and Congresswoman Hoyle and Speaker Fahey for joining us here at the Lane County Developmental Disabilities Building. This building was just built a few years ago, and it's one of the critical services that we're able to provide because of our strong partnerships at the state and federal level. And it is most notably the Medicaid funding that helps us run this particular facility. We appreciate your advocacy in the House and the Senate for all the needs of our communities. Access to healthcare is clearly top of mind here in Lane County. In Lane County, we began 2025 with 35.2% of our population, that's nearly 135,000 folks in Lane County, who rely on Medicaid to pay for their health care. We followed the news with NDC on HR 1, the reconciliation bill, and we fear that we really don't even know the half of what the impact is really going to be for not only Oregon, but also for Lane County specifically. And we're trying to look at all of our services and really assess what is possibly going to be impacted from that bill. You'll hear shortly from our local providers, Orchid Clinic, who we've got here, and PeaceHealth, that serve Florence, Cottage Grove, Oak Ridge, a lot of our rural places where residents go, and we want to preserve the fact that they can get service in rural communities and not have to drive into the Eugene-Springfield metro area for those services. Because we know if they have to take that commute into town, they are less likely to seek services.
And Heather, we're talking about the most disabled folks in the area, right?
We are. Those that are on Medicaid are not those that normally have insurance through their employer. And our vulnerable population in general, and we want to ensure that they can seek care in the most accessible way possible without putting additional hurdles. And transportation to metro centers is one of a very big hurdle that they need to take in order to provide or get their primary care services that we have here in Lane County. We serve at our federally qualified health centers nearly 30,000 people in Lane County that rely on these Medicare funding. And that is a large part, a percentage of our population that would not otherwise have the opportunity to seek health care in a way that is affordable to them. And if they don't have that service, if that is cut back for them, they are likely going to go to our emergency rooms and not have the insurance that they need in order to pay for those services, then be billed back for it and have these healthcare bills on their credit reports. It's just a vicious cycle if we see the reduction of services for these very vulnerable populations. And with that, I would like to pass it on to Speaker Fahey.
Thank you, Commissioner. And thank you, Senator Wyden and Merkley and Congresswoman Hoyle for being here. I think it is hard to overstate just how dire HR 1's consequences are going to be for Oregonians and for the state of Oregon. Innocent people are going to suffer from these cuts. Cuts to health care, cuts to food assistance, and as Senator Merkley said, these cuts are going to fund tax breaks for the wealthiest Americans. The state of Oregon is required to balance our budget. We are constitutionally required, like other states, to do so. And the reality is that no state's budget is built to backfill all of the cuts that are coming. We have a state analysis that was released last week that shows that over the next few years, $15 billion in federal funding is going to be lost in the state of Oregon. That includes about over $11 billion in cuts to the Oregon Health Plan, to Medicaid, which means hundreds of thousands of people could lose access to health care. It also includes about $3 billion to food assistance through SNAP, which means children and family, it takes food off the tables of children and families around the state. So at the state level, one of the things we are concerned about is, A, we can't backfill those federal cuts. We aren't set up to do that. But the bill will also blow a significant hole in our state budget for the current budget cycle. And that is because there will be less revenue because of the cuts to corporate taxes and individual taxes. And there will be less revenue coming into the state because of the economic chaos caused by Trump and the tariffs, the on-again, off-again tariffs. We're already seeing weakening job reports and other troubling signs of our economic future over the next couple of years. We will also see loss of direct federal payments for SNAP, Medicaid, and other programs. And we will see, as folks referenced, the increased administrative costs from the new mandates, like redetermining eligibility every 6 months and implementing the new work requirements. So what does that mean? It means a generational loss of medical coverage in our state. We have done amazing work in the state of Oregon to make sure that people have access to health care coverage. 97% of Oregonians right now are covered, have access to health insurance. 1.4 million Oregonians, including half of all children, rely on the Oregon Health Plan for coverage. That's Medicaid. So the 6-month eligibility checks and the work mandates in H.R. 1 will mean that somewhere between 100 and 200,000 Oregonians will be pushed off of coverage. That will cost the state about $2 billion every 2 years and will leave hospitals with skyrocketing uncompensated care. That might mean closures of rural hospitals in the state. I also want to touch on something Senator Wyden said about the folks who get their health care coverage through the exchange. Some of those subsidies are going away. At a time when cost of living and affordability is the top concern of Oregonians, this bill, Donald Trump and congressional Republicans are going to push up the cost of health care for working families all around this state. We will see, from the healthcare provider perspective, I know we will hear from providers here, it's going to, cuts to the hospital provider tax revenue and state-directed payments are going to destabilize our healthcare system. We're going to see coverage shifts and gaps as eligibility tightens. More people, including refugees and other legal non-citizens, will be forced into alternative programs, while overall the Oregon Health Plan enrollment declines. And we'll see other ripple effects like increased healthcare costs as ER rates and incidents of uncompensated care increase. In summary, H.R. 1, especially in the context of the general financial chaos that Trump is causing, presents some of the most dire fiscal problems our state will have faced in decades. Our state budget cannot make up an $11 billion shortfall. But I know the leaders that you see today will continue to fight for Oregonians. And as House Speaker, I'm working very closely with Governor Kotek and other state leaders to defend Oregonians from the worst impacts of this bill.
One other aspect of timing, they have conveniently decided that they're going to give the tax breaks to the billionaires immediately. But if you really want to know what's going on with the health care cuts, you've got to wait until after the 2026 election. In other words, I've been having all these town meetings. Republicans don't have town meetings because they can't defend the kind of things that we're talking about, but they've sure taken care of themselves. Help the billionaires now. Costs with respect to what really is going on, you're not going to find out about until after the election. So part of what we have to do is talk about what's realistically going on, and that's why we so appreciate having you.
I want to emphasize the point that Julie made. 1/3 of Oregon children are on the Oregon Health Plan. 1/3. And the ratio is much higher in rural areas, less affluent areas, than in urban areas. Huge impact. And also affected by the Oregon Health Plan are a whole lot of people with disabilities, a whole lot of long-term care, and you also have a whole lot of veterans. So it's important to think about the populations that are affected in dramatic and significant ways. And when you lose health care coverage in a rural area, it isn't just the people on Medicaid who lose health care coverage, it's everybody in the community. They can have private insurance, but now your clinic is gone or your hospital is gone. Your health network that supports you and your family is profoundly diminished.
Here's what we learned in the Finance Committee with respect to nursing home care and long-term care. The head of the program is Mehmet Oz, Dr. Mehmet Oz, and he said we had nothing to worry about because AI was going to take care of all the older people. And so everybody gasped around the room. We said, how are they going to do that? How are they going to take care of an 85-year-old woman who needs help going to the bathroom? That's when he said he would come to Oregon. We haven't seen any sign of him again for the very reason that we're talking about. They want to hide the ball, and why getting the word out through all of you and hearing about these real accounts so that we can go to the floor of the Senate and we can go to the floor of the House and talk about what's really going on for disabled folks and nursing home folks and kids and the like. That's what this debate's got to be about, and we appreciate you.
So we're going to hear from all of you. Should we start with PeaceHealth?
Sure. Great, thank you. Well, I'll just say I feel pretty heavy right now listening to what you all are sharing and thinking about what is in our future. But first, as summary, I'm Alicia Beamer. I'm the Chief Administrative Officer at PeaceHealth. And in summary, PeaceHealth is a not-for-profit healthcare organization. We serve Lane County. We have 3 hospitals, one in Peace Harbor, in Florence, Cottage Grove, a medical center, and also River Bend. And we also have primary care through our PHMG clinics. And we also have home health and hospice services. We are the primary health care provider in the area, and River Bend is the largest and most advanced hospital between Portland and San Francisco. And we're also Lane County's largest employer. And we are very proud to serve thousands of Oregonians, and they depend on our care. And as we listen to this really resonates on those thousands of lives that we serve. Hospitals, as you've shared, are at a tipping point, and as year over year, we have already been experiencing losses, and they've forced us to cut workforce as well as close services. And again, we are concerned about the one big, beautiful bill, that it will add pressure and create barriers, to say at the least, and in maintaining key services in our communities. We're experiencing soaring expenses. Dr. McGovern will talk to you a little more about that. But one of the things as I was thinking about this was through the COVID pandemic, much of the financial strain that we felt was because of the added workforce. And we are really proud of the work that we've done moving beyond COVID and stabilizing from that. We've reduced our reliance on traveler labor from 25% to 4%. And those are through key partnerships that we've had with LCC and Bushnell in our community to develop local and reliable workforce. Our nursing turnover rate is half of what it is nationally, so we've really worked on stabilizing our services. And as I listened to you, Congresswoman, talk about just the potential that there's 11 out of 33 potential hospitals could close for critical access, thinking about as we're here trying to stabilize beyond the COVID pandemic and proud to be doing that. And what could be at risk as we're also looking at in the future. And a few of our projects that we're really excited about looking at in our future are a 42-bed inpatient rehabilitation hospital that we just had our topping off for last week. We just opened our first of the kind pediatric urgent care in our location. And we're working very hard and very proud for our work with Lane County in the co-location of the psychiatric hospital with the Lane Stabilization Center, and also expanding our emergency department to better serve our community. So thinking about how we're expanding our services may now be threatened by these reduced reimbursement rates as well as and cuts to Medicaid and Medicare. So thank you very much for your time and advocacy And I know Dr. McGovern has more to share on this.
We want to get everybody involved in the conversation, and our time is rapidly evaporating.
Sorry.
So, Dr. McGovern, maybe we come back to you, but let's hear kind of some short sense of how you're seeing these impacts affecting you. And
Jeff,
maybe
can I ask one thing?
Yeah.
Dr. McGovern, were you going to talk about prescription drug prices? Because that's what I heard on the trip this last couple of weeks, and Senator Merkley and I have both been all over this issue. So we want to make time, especially for somebody to talk about escalating prescription drug prices.
I wasn't.
But you will.
But I can.
Good. But let's do what Senator Merkley said. Let's get everybody in first.
let's turn the community health side and Orchid Health, which has 6 local community health centers scattered around Oregon.
Thank you. Thank you for being here. My name is Orion Falvey. I'm the co-founder and executive director of Orchid Health. 12 years ago, my co-founder and I, while attending University of Oregon, we had a vision that everyone in Oregon, regardless of where you live, would have a fair and just opportunity at living a healthy life. And every year, the Oregon Office of Rural Health publishes an Areas of Unmet Healthcare Need report. It's a great report that they offer showing health disparities based on zip codes around the state. And at the top of that list was Oak Ridge, so having the least access to some of the highest disparities. So my co-founder and I kind of set out on this journey to bring health care to rural communities, except for local care. And kind of quickly we saw proof of this model, that if you can bring care to local communities. In Oak Ridge, over the first 3 years, we cut ED utilization for Medicaid patients by 40%. So immediately in 3 years, with a nurse, complex care manager, a doctor, a community health worker, an integrated behavioral health model, where we spend an hour with patients to really get to know them, immediately 40% reduction in ED utilization by having the kind of the safety net local care for all communities. Over the last 10 years, we've grown to 6 rural clinics. We have clinics in McKenzie River, Oak Ridge, Bonita, and then rural communities up in Clackamas County. And we've continued to see really eye-opening outcomes based on this model. We serve about 10,000 patients, half are Medicaid. So
Half for Medicaid,
Yeah.
half Oregon Health Plan.
Yep, half Oregon Health Plan, about 25% Medicare, 25% commercial. And we're the only clinic in town in 4 of our 6 communities. And in each of these communities, we entered the community when the existing clinic shut down, oftentimes giving 2 weeks' notice to the 4,000 people living there that their only access to healthcare was shutting down. And we get these asks every couple of months, clinics around the state, Office of Rural Health asking if Orchid will open clinics in these rural communities. And so we have this proven model, and like you're sharing, we are concerned about members losing OHP coverage and the impact on Orchid. We operate on a good year, maybe on a 5% net operating margin, which we use to invest in our facilities, to provide better benefits, to hire and expand programs. And based on kind of our forecasting, if 10% of people in Oregon lose OHP coverage, 200,000 Oregonians, that will evaporate that margin completely and leave us with kind of any ability to say yes to these opportunities when rural clinics are shutting down. We have a vision for 2030 to open up 4 more rural communities in towns between 2,000 and 40,000.
4 more around here.
4 more in Oregon.
Yeah.
Yep. And yet, kind of, that's uncertain based on our funding model and the funding we get from Medicaid. And we're mostly value-based. We've formed great partnerships with CCOs and other payers, so we get paid based on the members that are assigned to us, that we serve as their primary care medical home. We also operate 3 school-based health centers in rural communities. And I just want to kind of close by sharing a story that is like, this is more than just preventative and primary care. This is rural community members' social connection in their community. This is about getting infant car seats for them. Like we just 2 days ago, we had a mom with a young kid who were able to, when she first started seeing us, she had a lot of challenging situations and health conditions, and over the last 6 months, we've not only kind of helped support her physical and mental health, but also got a car seat and a car, and she's driving and making appointments. We had a couple, 90-year-old couple, who were celebrating their 65th anniversary a week ago. Just heard this story as well when I was at our Hoodman clinic, and they had their establishing care appointment on their anniversary, and they said establishing care is more important than our celebration. We're going to do this another day, and our staff threw them a party when they came in.
Oh, that's cool.
Joint appointments.
No, that's huge. Thank you. And it's just a huge threat for our rural clinics.
Yeah.
This is sort of,
Specifically the Medicaid cuts. And
thank you. So we're going to turn quickly to Planned Parenthood, and Amy Handler is here. And there's a provision in this bill that says that Oregon Health Plan cannot be used at Planned Parenthood clinics. It has been suspended by the courts, but we're not sure where that's going. But can you kind of give us a brief description of the impact it will have on folks here in Oregon?
And Amy, the Republicans did somersaults in order to get this benefit and Planned Parenthood benefit cut, because the Finance Committee and the parliamentarian section, we actually won the first round because they couldn't show it had anything to do with spending. And then they went and essentially dribbled a few dollars there because they were interested in ideological trophy. That's what you are, a right-wing ideological trophy, and you got 3 of your members of Congress who are going to fight them every step of the way.
Well, first, thank you. Thank you to all of you for all the work that you're doing to fight for us in Congress. Our patients feel it every day. I think one of the things, as I look around, you said, feeling very heavy with this conversation, and I think I feel heavy but hopeful because here in Oregon, we've worked so hard, and everyone, like Speaker Fahey, to pass the Reproductive Health Equity Act. Our patients, they don't get a bill. They've never paid for reproductive health care in the last almost 10 years because of the work that our state has done to protect folks. That could change based on this bill. So, like Senator Merkley said, the moment that the bill was signed, there was a provision that fully defunded Medicaid for Planned Parenthood. So essentially, Planned Parenthood can no longer bill Medicaid. It's tied up in the courts, it's going back and forth, and it's very uncertain, but it does look like it is making its way very quickly to the Supreme Court, where we expect we will lose. And so in that case, 70% of our patient population is on Medicaid. And so in Oregon, we serve about 100,000 folks across the state. This is, I like to say we do everything from A to B, which is abortion to vasectomy and everything in between. So that's cervical cancer screenings, breast cancer screenings, STI testing and treatment. Collectively in the state, we do about 60,000 STI tests, and we are actively trying to be part of the public health prevention work around STIs and cancer. We know that an investment in Planned Parenthood, so every dollar that gets invested in Planned Parenthood saves the state $7. So that's a big win. Also, these cuts for us have already happened, so we're waiting to see what happens with this court case, but we are trying to figure out if we are going to have to close health centers in the state, or how we can make this work. And I think through deep partnership with the state, there are pathways forward where we can continue to see every patient. Our doors are open. We haven't turned a single person away since this bill was signed, and we don't plan to in the near future. But we're deeply grateful for the partnership that we have with each of you in the state and in Congress stepping up for us. So
Thank you, Amy. And just this provision is horrific impact on women. Shut down a key provider of healthcare service. I know you serve some men as well, but primarily women. And the idea that women seeking full range of reproductive care are going to be blocked from using their health insurance at Planned Parenthood clinics. Massive impact on our state healthcare system and the lives of so many women. So thank you. Let's turn to the Health and Human Services of Lane County. Eve?
Thank you. In our community health centers in Lane County, we serve, as Commissioner Buck said, almost 30,000 residents of Lane County, 70% of whom are on the Oregon Health Plan. We are the safety net provider where we are consistently accepting new Oregon Health Plan patients as private providers are having to manage their payer mix and open and close to Oregon Health Plan as their finances allow. What permits us to do that is both great state support for our programs through RAP payments, as well as a federal base grant as a federally qualified health center. Of course, that is not Medicaid funding, but we are being asked to reapply for our service area competition grant right now. We are aware from a recent executive order that there will be a termination clause for convenience within our upcoming grant. And that leads to significantly
Meaning your
added-
grant can be shut down at any time at the
Exactly.
decision of administration.
Yes, which leads to incredible instability for us and a sense of impending doom at any time. We're just not sure what will happen financially. We are required to take care of everyone regardless of ability to pay. We are barely scraping by. Our expenses have increased more than 60% over the last 4 years, and our revenues have remained largely flat.
Prescription, big part of that.
So the 340B program helps us significantly, which is also under threat.
That's what I mean, yeah.
Yes, should the 340B program not be present, should we lose our base grant, I don't see a pathway that we can make ends meet.
The base grant plus prescriptions under 340B would close your door.
Without additional
That's
assistance,
what I mean, yeah.
I would not be able to balance my budget.
That's what I mean.
That's right. And it is not just our community health center clinics. Of course, we are the safety net behavioral health system. We are the community mental health provider. Medicaid supports the vast majority of our residential behavioral health services, as well as individuals with serious and persistent mental illness due to their disabling condition, who are at risk of not being able to receive treatment. We already see these individuals on the streets of our community. And we anticipate, should we have less access to residential facilities, that population will increase. We as well have seen Medicaid dip into the housing space, particularly prevention funding through the Medicaid 1115 waiver. Should we lose access to those benefits, we saw significant state reductions in investment in prevention funding for eviction prevention. Our assumption was that that was because of the significant investment with Medicaid 1115. We anticipate that in the next budget year, HUD making reductions as well, which means people who already cannot afford housing. We have one of the highest rates of homelessness in the nation here in Lane County. And with reduced access, if we lose 1115 or portions
That's the
of the
HRSN, right? The
Correct,
residential
the
assistance.
HRSN. If we were to lose funding for that, we anticipate seeing increased rates of homelessness within our community as well. Developmental disability services, as Commissioner Buck said, is very largely Medicaid funded. And in public health, we rely on Medicaid for our nurse home visiting program, of which 40% of our clients are unhoused. 70 to 80% have a significant mental health condition. And the average, the median income for the people we serve annually is $15,000 a year.
So Eve, you mentioned mental health several times, and I know that as Ron and I do our every county every year, there's not a town hall, I think, that mental health doesn't come up in some context of our youth in our schools, of our homeless on the streets, of the stresses of the world impinging. And so I just really wanted to draw attention to that point you're making.
Absolutely.
Thank you. And Dr. Murthy.
Yes, I'm Dr. Murthy. I'm the medical director for the Community Health Centers of Lane County. We are about 8 clinics and, like he said, serving 30,000 patients. So I'm here to give you the provider's perspective on how the bill would affect us. Like you all know, primary care access is really bad in the state right now. It's very hard to find a primary care physician. And having patients who are affected by this bill will just add to the burden of our providers. We can't turn away patients. They're only going to get sicker. All these years of all the gains we have made with preventative health will take a setback because patients won't be coming in and will only come in for really serious medical conditions. Now, this bill fails the medical providers in that it does not uphold the quadruple aim of healthcare, which is provider satisfaction. And our providers are really at various stages of burnout. Many of them have moved away from practicing this profession, and especially primary care providers are very vulnerable. The other challenge is trying to find specialists who will take care of our Medicare patients, Medicaid patients. And, you know, as a primary care provider myself, it is really challenging to practice out of my scope because I can't get a cardiology colleague to see my patient or an infectious disease consultant to see my patients. So that is also going to be a huge challenge. And then I think lastly, in our FQHC, we have many providers who come for loan forgiveness. That's an opportunity for them to take care of it. And with the new bill, I think putting a limit on the student loans will also impact us.
Yeah, breathtakingly dumb. I had a fellow come to my town hall meetings through Eastern Oregon, and he went to each one for the sole purpose. He had just graduated from medical school. He was looking for an opportunity in Oregon, and he just went from meeting to meeting to meeting, hoping that he'd run into somebody who might hire him, and it was like a blank. Everybody said, we're trying to keep who we've got, let alone add. And, if anything, you're understating this 4-alarm fire with respect to providers in rural Oregon. It is a calamity everywhere.
Let's turn to long-term care, and Sherry, with your experience with the memory care world.
Okay, thank you for having me today. My name is Sherry. I am the Executive Director at Mackenzie Manor Memory Care. I have been in long-term care for over 15 years. Right now, my facility is home to 39 residents. 36 of them are Medicaid funded. 6 of these people are so young with dementia that they don't even qualify for Social Security. If we take their Medicaid away, these people risk being homeless. They risk being placed into unsafe environments, whether that means that the home itself is not safe or that the people caring for these individuals are not trained enough to know how to take care of somebody with dementia. Somebody with dementia and Alzheimer's, they are so vulnerable, and they don't always know right from wrong. They don't know that their body is in trouble. They can't, if they get out in inclement weather, they don't know that they're overheated or that they're freezing to death. We have very high staffing ratios in our building, and if we lose that Medicaid, we lose that funding to be able to pay our staff. Our staff are the family to many of our residents. Many of our residents don't even have families. The families that we do have are asking, what happens? Are you gonna put our family members on the street because you no longer have staff or the ability to pay for their day-to-day living? This is just a critical topic, and we desperately need help. We can't let this vulnerable population be put to the streets or into unsafe environments, or we're crowding people in because we can only afford to fund one building for every 3.
Mehmet Oz should be here to hear you, because he was the one who said AI was going to take care of your home.
They will never, ever be able to care for our residents the way we can as human
Absolutely.
beings.
I want to turn to Commissioner Trigger and then come back to you, Dr. McGovern, again, keeping your comments succinct because we're running a little behind schedule.
Thank you, Senator. I will so appreciate you all being here. The hope that we have is because we have such great advocates and allies in Washington and in our state legislature. So my very brief comment is to just emphasize what's come up a little bit, which is that delayed care is more expensive care, and people without access to early care end up being sicker, more acute, needing more expensive care later, and that mental health care is health care. And so specifically, I just want to call out that Lane County has been working to build our Behavioral Health Stabilization Center. It's been mentioned before by our wonderful partner at PeaceHealth, Ms. Beamer. It's been 6 years in the making. All of you know that. You've been strong supporters and advocates and helped us secure some of the funding. And a special thank you to Speaker Fahey, because this legislative session that just concluded brought us that last mile funding and the ability to construct the facility. We have a site purchased. We have a partner in PeaceHealth. So the capital costs are covered. Our concern is the business model that we've been operating under the assumption we could implement once we build this facility, where we're finally at that place after 6 years of being able to build, is what is at risk if we don't keep the Medicaid program whole. It relies on being able to reimburse for services to fund this critically long overdue, much needed service for both youth and adults for mental health care in our community. So I know you all know that. You've been phenomenal advocates, but just an extra pin in the fact that these behavioral health care services are at risk, and all of this work and investment we've made to get to this point for this initiative is at risk. I wrote down, Senator Wyden, breathtakingly dumb. That is, that's my quote of the day. Thank you for that, and thank you again.
I'd rather us fix this rather than have a quote.
Yeah, but that is exactly what this is. It is breathtakingly dumb.
Thank you, Commissioner.
Thank you.
Dr. McGovern.
Thank you. So I'll be brief. Just financially, we've had negative margins for the last several years. The last fiscal year was worse than the one prior. 2 years ago, we gave away $50 million in free care. This last fiscal year, $70 million in free care. 70% of our payers are government, so 50% Medicare, 20% Medicaid. We can't afford cuts to 70% of our patients. We can't afford the 340B program to take cuts. We can't afford more free care. So, and I wanted to then link to something that Senator Merkley kind of slipped in there. This isn't about Medicaid, uninsured. This is about all of us.
Yeah.
Everything that happens that impacts healthcare negatively in the community lands in the emergency department.
Yep.
So, cutting SNAP, nutritional support, they get sick, they end up in the emergency department. Cutting insurance, they can't afford their prescriptions, they end up in the emergency department. Cutting public health, behavioral health, they end up in the emergency department. If we close hospitals, then more people come to Riverbend. So this is about us as a community. I don't care what kind of insurance you have. When you come to an emergency department that is boarding 30 patients out of our 54 beds, or next respiratory season, because we didn't even talk about what we do in public health and vaccines, which make people sicker, they end up in the emergency department, they end up in our hospitals. Oregon has one of, I think we're number 1 or number 2 for least hospital beds per capita. We can't afford any more people to end up in our hospital beds. Those patients then trickle back to our ERs. It is access. Access is quality. You cut primary care access, you cut rural access, you close hospitals, not just in our rural communities. Our hospital systems in Oregon are at risk in our urban centers as well. Close a few hospitals in Portland, close hospitals between here and Portland, and now your access goes down significantly. So this is an impending healthcare crisis. It's not about Medicaid, although it is. That will cripple us and that will trigger it. But for me, as I sit here as the hospital executive for PeaceHealth in Oregon, I'm terribly afraid of what's going to happen with respiratory season. We are looking at an impending healthcare crisis, and that's 6 months away. You take these cuts out 2 years, and our rural hospitals struggle even more. We struggle even more. I have a lot of fear for where our healthcare system in Oregon and nationally is going to be 2 years from now because of these cuts. So I'll leave it there.
Thank you very much, Doctor, and thank you all for giving your feedback. This is a calamity for everyone in Oregon, everyone in the country. And the idea that all of this destructive impact on healthcare is done to finance tax breaks for billionaires, that devastatingly wrong. Mm-hmm. And we are going to do everything we can to counter it. There are short-term impacts, like we'll start to see premiums go up. We'll certainly start to see premiums go up a lot when they go up 75% or so on people buying policies through the ACA exchange, Affordable Care Act exchange. We're going to see a lot more impacts unfold over the next couple years. And then provider taxes dropping over a 4-year period, starting a couple years out from now. I mean, so we have to reverse this, and we're going to have the healthcare community rallying throughout our state and throughout our nation to say it's wrong and bring pressure to bear. But it's so helpful to hear your individual components as key players in this healthcare system. So I just want to close by thanking you all so much. Ron has a closing comment.
I'm in public service, because of health care. I was co-director of the Oregon Gray Panthers for 7 years. We have never seen a fight like this. Nobody, Democratic or Republican, has tried to turn back the clock in this way. $1 trillion worth of cuts. And people understood when we began the Trump administration there was going to be a debate about health care. But this goes way further than anybody's talked about. So this is the most important issue, folks. You guys know that because you're on the front lines. Because if you and your loved ones in Oregon don't have their health care, everything else falls apart. So we wanted you to know that we're getting ready for what's coming. And it's going to start in about 6 weeks or so, because this is getting towards the end of August. And by October, people are going to get sticker shock with these premium increases, and they're just going to mow us down in terms of hospital coverage and provider coverage and all the things we're talking about. So we wanted you to know we are all in on this fight. We can just go right around the table here and talk about what we've got to do and how we're going to do it. So thank you for doing this, and why don't we let the Congresswoman, we're in her district, and the senators aren't supposed to
She's going to wrap it up.
Yeah,
Yep,
aren't supposed to just Bigfoot the place. Go
I
ahead.
think I can't say it better than any of you who are on the front lines have said it, but it is detrimental, and this is part of a larger, long-time effort for billionaires who want tax cuts to completely overturn all of the benefits that were made during the New Deal. So, child labor, minimum wage, access to health care, public education, right? If we don't have tuition reimbursement for providers that are willing to serve underserved communities, then only people that can afford to pay for medical school will become doctors or nurses. So this is calculated, and working people will suffer, and the kind of district I represent and that you all serve are the ones that are going to suffer the most. So we just have to keep speaking out, and the most important thing that we can do is tell the stories that you tell us. And Sherry, I know the work that you do, and these are not people that every 6 months are going to be able to reapply for their Medicaid. This is just cruel. So thank you, keep fighting, and again, keep in contact with us so that we can tell those stories and call out our colleagues on the reality of the situation, and hopefully get them to work with us to move the needle.
Thank you all very much.
We'll take a few questions if we could before we wrap up. You guys have any questions? Go ahead.
Hank, you want us to stay here or go over there?
No, let's do it here.
Good, just a little faster.
Go ahead, Alan.
Question for the providers around the table. So, can you share which aspects of your services most utilize Medicaid funds? If that makes sense.
All of them.
From morning till night, they use them all.
Other questions? TV? Web radio?
In the most recent jobs report, we saw that for all of Oregon as well as Lane County, the biggest area for jobs growth is healthcare coverage. What would further cuts do for the economy here if we see more job losses as unemployment rises?
So PeaceHealth has said they are the largest employer. We also are seeing massive cuts at the University of Oregon, at Oregon State. We're going to see these in Lane County. These are major employers in Lane County, and where our tax system is based on income tax. So when people are most in need, when our economy starts to crash, that's when they need services, and that's when we have less funding. So I think this is going to be a cycle that's devastating, and we have to figure out how to fight back, because we're not the only state. It is not just blue states, right? It is across the country, and quite frankly, our rural communities are the ones that are getting hit the hardest, but Lane County is going to take a major hit.
Let me tell you what I'm fearful of losing. Yesterday I was at Rogue Community College, and they were opening up a special program to train folks in dental services, which has been a huge gap in the rural part of the state. The program that I was announcing yesterday was essentially something that Senator Merkley and I worked for years on in order to get it, because we knew that post-COVID, and as we are making this transition from having additional jobs other than natural resources, we've got to look at healthcare. And as I walked around that facility, I heard all about the opportunities for young people right now, and I was worried, number one, that somebody might take it away before we could really get it all off the ground. And certainly, if something like this bill that passed Congress were to go forward, we wouldn't have those opportunities in the future. Senator Merkley and I'd be fighting to keep what we have, let alone have something new.
And there are two pieces of this comprehensive attack on healthcare we haven't talked about. I mean, we've talked about veterans and the disabled and mental health and long-term care. We haven't talked about the attack on research funds to improve our medical services, and particularly the recent assault on messenger RNA research, which Oregon Health Sciences University was critical in developing mRNA technology that was the foundation for the COVID vaccine. And we haven't then talked about the assault on whether vaccinations make sense and their huge role in community health. So I just wanted to mention two more elements of this incredible kind of 360-degree assault on the health of Americans. And I can assure you the rest of the developed world is not going in the direction of destroying their own healthcare systems. Let's not do it either. So that's why we have to reverse so much of what is happening right now.
Senator,
go ahead, please.
listening to all of this today, listening to all the providers around the table about the impacts of this bill, I am just struck by what is the point of all of this? What is the point of Republicans in Congress passing a bill that will close healthcare, hospitals, community health centers? What is the point of making it harder for Americans to access healthcare, of increasing premiums at a time when people can't afford the basic daily cost of living? What is the point of taking food off the tables of families? As a legislator, I cannot imagine having a bill in front of me that would do all of those things and saying, yeah, that's a good thing for the state of Oregon, for America, and voting yes. I just can't understand the point. Why a Republican like Cliff Bentz or others around the country would say, yeah, that's going to be good for my constituents.
The point is tax breaks for the wealthy. That's the point.
And if you don't have town meetings like the three of us do, and you want to give these breaks to the people at the top, and you don't get to actually hear about the cruelty that you're going to see under these cuts, then people just say, oh, I'm going to call it waste, fraud, and abuse, which is essentially what they did. The three of us heard this for months and months. We are not going to cut anybody. And despite all the audits and the reviews and the like, they kept saying waste, fraud, and abuse. And I think we're seeing now that this is not about waste, fraud, and abuse. This is about you don't see the problem. You don't have town meetings and get out and listen to people and hear what we've heard from all of you. And I guess it just kind of goes by the board and they say that's the way it goes and put it off till after the election so it doesn't hurt.
I've got a question. I was wondering, with all of this being said, how are we planting seeds for change, and what can an individual do going forward with all of these obstacles?
Single best thing is be a whistleblower. When you have this kind of cruelty, what we're talking about here today, call the three of us, and we make it a practice of working together and walking it through the system, and we win some of the fights. We don't win them all because it's not the same thing as passing a piece of legislation, but if everybody here will just be a whistleblower, and if something happens on Tuesday afternoon that really violates every spirit of kind of fairness in healthcare, call us, we'll follow it up, we'll get going.
In response to your question, I want to kind of paint a broader picture. We are in the middle of an authoritarian takeover of our federal government, unlike we have seen in the history of America. The president is ignoring the laws that apply to the executive branch, like you can't fire whistleblowers without cause. He is proceeding to trample on due process, which is the way what protects us, our freedom from an over-aggressive federal government. We are seeing him utilize bills and powers that don't exist in the law. For example, the tariff power. There is no law that gives the president the ability to change tariffs, and yet look how that's in the news every day. The courts are letting us down to some degree. They're challenging some things. But when people ask me, what can you do right now? It is so important to be off the couch. It's so important to be stridently, ferociously holding your electeds accountable. It's so important to join affiliated groups about individual policy areas that you care about, be it reproductive health care, be it the environment, be it something else. And it's incredibly important to be engaged in the next elections, because if we don't have a huge turnaround in the next elections, we are going to be living in a long-term strongman state that is not government by and for the people, but by and for the powerful. And what this is in healthcare, to address the speaker's question, this assault on healthcare to tax breaks for billionaires, this is government by and for the powerful, trotting all over the people.
To be continued, everybody.
Thank you.
Thanks, Jeff.
It's got to drive a massive rebuttal.
I used to hate producing. I mean, I still don't love producing, but I used to, when I first started out just